So right now, what you guys are seeing are the most common medical issues that the Air Force sees day to day. If you look at the left side, we're looking at some of the most waived conditions, meaning if you have something like this, most likely you're gonna get that waived to join the Air Force. But if you look over to the right side, these are the least waived conditions, meaning you most likely won't get these conditions waived to join the Air Force. So to give you guys some insight on why the Air Force disqualifies people with these conditions, when you guys get to basic training is designed to be a little bit stressful, right? So if you have something like asthma, you're gonna be doing PT, and if you can't breathe properly to do the PT, then most likely you're not gonna be able to complete basic training, and it was just a waste of time for you and for the Air Force. So in this video, we're gonna talk about a couple different medical conditions like asthma, ADHD, depression, anxiety, and how you can improve your chances of getting something like that waived to join the Air Force. So if you had asthma before the age of 13 years old, then it should be pretty easy to get you in. But if you were reliably diagnosed and symptomatic after your 13th birthday, then you would be disqualified. You could get a potential approval to join the Air Force if you haven't had any medications within the last 3 years and you had a normal pulmonary function test within the last 90 days. So you would have to go reach out to a doctor and request a pulmonary function test, and then based off of that pulmonary function test, that could be the single most important thing that helps you get qualified to join the Air Force. Some of the medications that they're gonna be looking for to see if you've taken within the last 3 years would be things like inhaled steroids, single air, or short-acting beta agonists, something like albuterol. If you've had any of that within the last 3 years, most likely you're gonna be disqualified. And something to further help your chances of joining the Air Force would be to grab all your pharmacy records from the last 5 years. And the reason why you're doing this is so the Air Force can see if you had to go get any prescriptions for any type of asthma medication within the last 5 years. If your pharmacy records show that you have, this is gonna be something that will hinder you getting qualified to join the Air Force. If you had a history of ADHD before your 14th birthday, that should be pretty easy to get qualified as well. But if you were diagnosed with ADHD after your 14th birthday, that's when things get tough. So the way to get approved, you would have had to been off of your medication for 15 consecutive months prior to you starting the process of joining the Air Force. You would also have to gather any high school and college transcripts. The Air Force is going to be looking to see if you have a decent GPA. If you have anything lower than like a 2.0 or a 2.5 even, then most likely you're not going to get qualified. They also want to see your 504 plan if you had one, and any individualized education plans if you have any of those. They're also going to be looking to see if you had a history of any other mental disorders. Usually if you have a history of ADHD attached with any other mental disorders, those are usually no-goes. And also, you're probably going to want to provide some pharmacy records for the last 3 years. They're also going to look for documentation of adverse academic, occupational, or work performance. So one of the best things you can do to improve your chances of joining the Air Force would be to go to your job, go to your supervisor and say, hey, can you write a letter saying how I perform at work? Or you can go to one of your teachers or your counselors at school and ask them to write a letter about how you perform at work. And in that letter, you want to have something like, you stay focused, you stay on task, never have to come to you and remind you of what needs to be done. You're pretty independent and driven and motivated to get the job done. That's the kind of stuff that they want to see in those letters, and those kind of character letters are going to help improve your chances of getting something like ADHD qualified. And for depression and anxiety, it's pretty much going to be the same stuff that they're looking for both. They're looking to see if you've had any symptoms or treatments within the last 36 months, meaning like counseling or medication. Most likely you're not going to get qualified. Some of the other big things that are going to disqualify you with depression: if you've had outpatient care, including counseling, for longer than 12 months, that's going to be disqualifying. If you've had any inpatient treatment, like a hospital or a residential facility for depression, then that's going to be big for disqualification. And lastly, if you have any reoccurrences, something like this depression went away, like let's say you had 12 consecutive months of counseling and then you stopped for like 24 months, but then you went back for more counseling, that is going to be a huge disqualifying factor when they're looking at your depression records. So ways to get your depression improved, you would want your counselor or your psychologist, psychiatrist, whoever that is, to basically interview you and determine if you have depression anymore. And then they will give their professional opinion. They will write it down. And you would also want them to write a statement about the possibility of you having depression in the future because of the Air Force or because of basic training. Depending on that statement from your counselor, psychologist, psychiatrist, that goes a long way when they're determining if you're qualified for the Air Force. But keep in mind, even if you get all of this stuff, the chief medical officer at MEPS, that's pretty much the head doctor at MEPS who's going to be looking over your stuff to determine if you're qualified or not, they have the ability to say no, even if your doctor has written a letter saying that they feel that you are fine to join the Air Force. If they do say no, you can ask your recruiter to send all of your medical documents to the Surgeon General of the Air Force. And the Surgeon General is going to be the doctor for the Air Force who looks through things that the chief medical officer may not want to qualify. I've had plenty of people get their stuff sent to the Surgeon General and get qualified for something that the chief medical officer said no to. So it's not over once the chief medical officer says no. And sometimes even when the Surgeon General says no, it's not over. I'm gonna give you guys a story about one of my applicants and how we got him qualified. So my applicant had a history of Asperger's syndrome. So he had it documented all throughout his medical records, and he's pretty much getting disqualified by the chief medical officer, and he got disqualified by a Surgeon General. He told me, hey, I don't think I have Asperger's. So what I'm gonna do is go to the doctor that originally diagnosed me with Asperger's, and I'm gonna take a test, and it will determine whether or not I have Asperger's. So he went to the doctor, he took that test, and based off of that test, the doctor pretty much told him that you don't have Asperger's, you're just extremely smart. And because you're extremely smart, that makes you a little bit different than everybody else. So once he got that test, and he also got the doctor to write a statement, we got that and sent it back up to the Surgeon General. And then based off of that test and the statement from the doctor, the Surgeon General qualified him to join. So what I'm saying is, if you get disqualified by the Surgeon General, it doesn't mean that it's over. You're probably gonna have to do something to change the Surgeon General's mind. So whatever they disqualified you for, then you're probably gonna go take action for the condition that they told you you're disqualified for and get that fixed. I hope this video was helpful for you. If you have any questions, you guys can look all throughout my videos. I'm very active in the comment box. So if you have any questions, go ahead and drop a comment and hopefully I can try to answer it. If you haven't already hit that subscribe button, make sure you do. And until next time, check me out.